1, 2. Check, check. Hey, hey. 1, 2. Hey, hey. 1, 2. Hey, hey. Check, check.
Like most doctors, I began my career by swearing my allegiance to the Hippocratic Oath. As a pediatrician, I was so proud to be part of the tradition of the ancient doctors who swore, in the same spirit as we do today, to treat the sick and protect them from injustice, and above all, to first do no harm. Since the times of Hippocrates, medicine has evolved in unimaginable ways. Inside our clinics, we've become brilliant at treating our patients' symptoms. But outside our walls, some of these illnesses are growing to epidemic proportions. Of course, we ask ourselves, what is making people sick in the first place? And why do they keep coming back? In our journey to diagnose and treat the body, we've been to the moon and back many times over, masters and explorers of the very small. But 20 years ago, some of us saw that to understand the problem, we had to take a wider view. From that vantage point, we saw thermometers, each containing enough mercury to poison an entire lake, piled up in our trash. From an even wider lens, we saw medical waste incinerators on our own properties throwing toxic fumes skyward. Dioxins and mercury from waste incineration fell to earth, entering the water we drink and the fish and animals we eat, poisoning our bodies and the developing brains of our children. Our own fingerprints were all over the scene. We were contributing to making our own patients sick, all in direct violation of the oath we had sworn to do no harm. So we formed a coalition of doctors, nurses, and advocates to push back, and pushed healthcare to stand with our oath and clean up our own house. Today, only a handful of incinerators exist in the US, and mercury thermometers are going the way of the horse and buggy all around the world. But while you listen to me, the climate is changing, and the people we serve face perhaps the biggest harm of all. Now we need healthcare to be a leader within this widest scope. Look at healthcare's global footprint. We consume huge amounts of energy on every continent, contributing to climate change and air pollution that kills 7 million people a year. In the US alone, healthcare is responsible for 8% of greenhouse gas emissions. But here's our leverage. We are 18% of the US economy and 10% of the entire global economy. The changes we make really can move entire industries away from harm and set new norms that will positively impact our patients' health. Imagine, for instance, if healthcare fought antibiotic resistance by purchasing only antibiotic-free meat. Or how innovative solutions to eliminating waste, like biodigestion, could help power hospitals and reduce air pollution around the world. Healthcare could help make renewable energy viable. By choosing to turn away from fossil fuel, we would reduce the carbon emissions that harm our patients and our planet. We stand at a turning point in the course of medical history, and we can move to a tipping point. It's within our power and our mission. Dr. Martin Luther King said the moral arc of the universe bends toward justice. Join us as healthcare bends toward a more just and sustainable future, rooted in our original oath: do no harm.
Hello, everyone. Good afternoon. Thank you so much for joining us today, whether in person. I see there's a couple of people joining online as well. So welcome to our session. My name is Belay. I am the Climate Officer for Healthcare Without Harm Southeast Asia, and it is my honor to welcome you all to our session, Resilient Health Systems, Localizing Climate Policies and Tools for Accelerated Action. This session is co-organized by Healthcare Without Harm Southeast Asia, Melbourne Climate Futures of the University of Melbourne, FHI 360 Asia Pacific, and the United Nations Framework Convention on Climate Change, or UNFCCC. And we are co-presenting with Sunway Center for Planetary Health, St. Luke's Medical Center College of Medicine, and Health Systems Global. Today, we will be delving into the critical integration of health considerations into climate policies within the Asia-Pacific region, emphasizing the interlinkages between health, climate, and broader sectors. Our discussion aims to highlight essential strategies to address climate crisis while underscoring the integral role of health as a driver for collective climate action. We will start with a fireside chat exploring the role of health as a driver for climate policies, and this will set the stage for the expert panel discussion that follows, honing into how we can localize strategies, tools, and collaborative measures for integrating health in all policies and building climate-resilient healthcare systems in the face of climate challenges. Without any further ado, it is my pleasure to introduce the moderator of the first session, the Fireside Chat. Please welcome Jacqueline Peel, Professor of Law and Director of Melbourne Climate Futures, the University of Melbourne.
Thank you very much, Bella, for the introduction, and thank you all for joining us for this fireside chat, Health as a Driver for Climate Policies. We're a bit lacking in the fire, also in the cosy setting of hot cocoa and marshmallows, but we are joined by two fabulous speakers. One in person, Dr. Jamila Mahmood, who's the Executive Director of the Sunway Center for Planetary Health. And joining us online, hopefully appearing shortly on the screen, but a picture to the right there, my colleague Catherine Bowen, who serves as the Deputy Director, Knowledge Translation and Policy Impact at Melbourne Climate Futures, And she's also a Professor of Environment, Climate and Global Health at the University of Melbourne. So I'm going to be asking each of our panellists a series of questions. Catherine, can you hear us? That's excellent. Okay, I'm not going to look back over my head, but I'll just assume that you're there in the background, Catherine. So we're here to discuss health as a driver for climate policies. And as a starting point, if I could turn to you, Catherine, to ask why it is important for us to consider health in the context of climate policies, and then what are some of the developments and trends that we're seeing at the global level around this climate and health linkage.
Thank you, Jackie, and many thanks for the invitation to speak in this fireside chat today. So why is it important to think of health? Because basically all of the climate impacts we are seeing will result in negative health outcomes. So whether this is extreme weather events like a flood or a drought or a storm or a cyclone, these can have what we call both direct and indirect impacts on our health. So there's obviously fatalities from these sorts of extreme weather events, but there are also injuries and there are also longer term impacts as well on our health and well-being. And one of these impacts that's more longer term and may not be so easily visible initially is the mental health impacts of climate change. And we're starting to understand much more about these mental health impacts of climate change, both from these types of extreme weather events. So these might be the what we call acute shocks and stresses. So these events like floods and cyclones, but also the more chronic stressors, droughts, sea level rise, and the impacts that these have on our sense of the importance of our environment, watching our environment change over time, and the really potentially quite dire impacts these have on our mental health and well-being. So there are a few examples, and I think the issue with climate change and human health, which has been talked about particularly by the Director General of the WHO as the biggest threat to our health. Climate change is the biggest threat to our health, but it's also the biggest opportunity. But the main point that I often talk about when discussing this issue is climate change will exacerbate our current underlying health concerns. And this will mean it's an issue of equity. So in places that are already have food insecurity and water insecurity, these issues, for example, will be amplified by climate change. And we know the places in the world that suffer from food and water insecurity, for example, are those countries and those communities that have generally contributed the least in terms of greenhouse gas emissions. So at its core, the health impacts of climate change is an issue of justice. So I think I answered your first question, Jackie, but would you mind repeating the second one?
Just to think about, Catherine, some of the developments or trends that we're seeing at the global level around that climate and health linkage.
So yes, we're seeing a range of different actions globally. So many countries are progressing their adaptation strategies, for example. So we know that the countries are developing their national adaptation plans, and the health component of that is just crucial if we're going to be able to respond to the health impacts of climate change appropriately and quickly. So this is a fantastic development that we're seeing globally, is that countries are now starting to strengthen their health national adaptation planning processes. And this is, we have to also thank the WHO for their support with with guidance documents in particular to support countries to develop their vulnerability and capacity assessments for these. We're also seeing really quite rapid transformations in the governance of climate change and human health. So, for example, in last year's final communication from the Conference of the Parties, for example, health was included there for the first time explicitly. This year at the Conference of the Parties, COP28, starting in just a couple of weeks, there will be for the first time a health day on the 3rd of December. So there's lots of movement in a positive direction, both in terms of country level development, and I'm talking mainly about adaptation at the moment, but also in terms of the international overarching progress in terms of the responding to the Paris Agreement and our commitments to that. So I think that there's good signs, but there's still a lot more to do.
Thanks, Catherine. So good signs, but a lot more to do. What we might do, Dr. Jamila, is to turn to the regional level. Obviously, we're here at Asia Pacific Climate Week. We've got a particular focus on what's happening in the Asia Pacific region. Can you tell us a little bit more about whether the drivers for integrating health as part of climate policy in the region are similar or different to what's occurring at the global level? And maybe some of the broad trends that you're seeing across Asia-Pacific countries.
Thank you very much, Jackie. And, you know, one of the audience members at an earlier Action Hub event pointed out that the Action Hub event was the first health event. So this is the second. And it's finally here, but it's not enough, is it? I mean, when we realize that health is actually central to everything, whether it's a climate or biodiversity crisis, it is a global health crisis, as mentioned by Catherine. So I'm glad we're discussing this. I think Asia Pacific, I've always described Asia Pacific as the most disaster-prone region in the world. And therefore, a lot of the disasters in this region is climate-related. And therefore, it will have serious health impacts, both direct and indirect, as mentioned by Catherine. So governments, organizations, the private sector have to take this very, very seriously. And it starts with, you know, the right policies in place, the right mechanisms for action, the right partnerships that need to be built. Are we there yet? Not really. I think that, you know, the region is waking up to that realization because the cost of doing nothing is just too high. The data is all there, the evidence is all there. But if you look at the NDCs that are reported, we're finally seeing quite a bit of data being inputted from the ASEAN region, you know, some data, but I think a lot more can be done. I hope that COP28 this year, I understand that about 7 ministers from the region will be going. I think this is a huge opportunity for them to be, you know, in those discussions and also push a little bit harder on the health declaration that has been drafted. I do think, you know, we need to address the elephant in the room, and that's often something that is glazed over at every COP, and that is the fossil fuel industry and the need for us to have a rapid and just transition from fossil fuels. How do we move to that discussion? In this respect, a bunch of health organizations, health-related organizations and individuals have signed this letter to the COP presidency calling for, you know, a real attention to putting the centrality of our addiction to fossil fuels and the need to decarbonize as quickly as possible and reduce emissions. All the data is there, the economic benefits of doing that. You know, how do we now bring that evidence to the political masters and the lawmakers who make those policies, create the incentives and disincentives so that we actually start really moving the needle on climate action and health.
Send an email to him.
Thank you. A little bit of interference in the background. We can't have a session without technical difficulties.
That's all right, Gladys. We will receive your email when you send it.
You mentioned, Dr. Jamila, that this is a new focus, climate and health. Yeah. It's an important one, but still, this is only the second event at this convening, the first Health Day being held at COP28. Catherine, I might turn back to you just to help us unpack a little bit more what it means to say global health and climate together. Is it just about a greener healthcare system, or is a broader perspective required?
Thanks, Jackie. So as we saw in the introductory video, the healthcare sector absolutely has a role to play in terms of reducing its greenhouse gas emissions. We know that healthcare professionals are really well respected and can play a very, very strong role in their advocacy efforts to push the healthcare sector to lead by example and reduce greenhouse gas emissions rapidly. We know this will not just bring health benefits, but it'll also bring cost savings. And ministries of finance are always a bit rough on the health sector or the healthcare sector, because it's the healthcare sector that often pulls out a lot of funding from national government. So any cost savings we can attribute to reducing our energy consumption, for example, will be seen as a really positive move. However, it doesn't just lie with the healthcare sector. So we're also really glued to what we would call the health determining sectors. So as I mentioned earlier, most of the health impacts will really arise from sectors that are beyond the health sector's purview. So this is agriculture, this is water, this is urban design, this is energy, of course, infrastructure. So it's really important that the health sector is able to articulate the benefits to our health from reducing greenhouse gas emissions with activities from those other sectors. So if we're able to explain to the agriculture sector, for example, ways to reduce methane from grazing of cattle, we'll have a health benefit because our emissions will be reduced. But it'll also be a health benefit in terms of, we know that eating too much red meat is bad for us in terms of our cardiovascular health, in terms of that, the prevalence of cancers as well. And so there are ways by which the health sector can articulate those health benefits, and so that other sectors can be encouraged to take greater action once they understand that there are many flow-on effects to our human health and well-being. So to answer your question, yes, the healthcare sector definitely has a role to play. However, it's really important we look at this in a systems approach, and that we're part of a bigger system, and the health argument can cut across all those what we call health determining sectors if we're able to share that message with policymakers. And just briefly to end, I'm doing a little bit of work in Australia at the moment to understand the sorts of messages that might cut through to policymakers if they understand better the health benefits of taking action in their own sector, whether it might be energy or transport, whether that actually, what sort of difference that will make. So we're trying to quantify the sorts of changes that might come from the better understanding of the health benefits of accelerated greenhouse gas emission reduction.
Can I come in on that?
Yes, absolutely.
Yeah, no, it just hit me a couple of points that are made, which I think need to be emphasized. Number one, we are stuck in our ways on putting things into silos, right? We have the Sustainable Development Goals with 17 goals, and sometimes each goal doesn't talk to each other. I think what we need is a radical departure from silos and individualism to one that is looking at a multi-systems approach and putting the climate crisis, the planetary crisis, the health crisis at the center of everything. Because we know from the recent pandemic that if you don't have health, your economy is stalled, your social fabric is disrupted, everything does not move in the direction you want it to travel if you don't have health. And I think it's an opportunity. It's still recent, although looking at behaviors, nobody will believe we had a pandemic. But let's also acknowledge the fact that this is an issue which is caused by us. It is an Anthropocene, right? And this is why we have a planetary health center. So what I'm saying is that how do we now push from a governance perspective, political perspective, social, health, economic, environmental perspective, that we need to now connect the dots. And that, I think, is still missing, because we are not looking at things from an underlying driver issue, which is really the Anthropocene. So, how do we now bring the global processes together? SDGs, One Health, planetary health, everything. How do we bring it together? And how do you then put it in front of political masters who have very short visions, so usually 5 years, and that they need to think long term. And they will not be able to think long term until we make it a political impetus for that to be high. And this, I think, will come from citizens, right? And I think this is where young people have been phenomenal, raising their voices, advocacy. And I'm critical of my own health sector because we as health professionals don't raise our voice enough. If you look at why that happens, is our whole education system. Only 15% of medical schools are teaching climate and health. It's unacceptable. I graduated in 1986. I'm a dinosaur. Now I go back to my university and ask, is climate and health taught? No. Right? So how on earth do you expect us to move this? Health professionals are the most trusted voices, irrespective of what situation you're in. And I think we have a responsibility to radically, revolutionize education at all levels and raise our voices. And again, how do we make sure this happens? Yes.
Reiterating an important point there. I think a couple of themes from that you've picked up are really a call to action to both the education sector to improve knowledge about climate and health, but also to healthcare professionals to use what is a very powerful voice. And you mentioned before the COP28 letter that you've signed on to about fossil fuels and their health effects.
Can I share one piece of news? I mean, I'm Malaysian, I'm based here, raising my voice on this thing, right? And Malaysia has now decided that it will produce, I think the first in the world, a national planetary health action plan, hopefully to be launched by the middle of next year. Now, what this is going to do is try to break the silos, bringing the economic, environmental perspective, and really thinking of how do systems now transform for us to be able to preserve the health of the planet and the health of people. I think this is the kind of thing that we need to be doing. Now, whether we succeed in actually implementing it in the end is to be seen. But I think if we start the conversations around those radical transformative shifts that need to happen within systems, then we have a chance of moving forward.
So, Catherine, I might bring you back in here. So, radical transformation, systems-based approaches, busting silos. How do we communicate that message of the types of co-benefits that can perhaps even cost savings, as you mentioned before, that policymakers might hope to see from integrating health into climate policies and the other way around?
Yes, I mean, it is, I agree with Jamila in terms of we need to create a different space that we're working within in order to see the urgent transformations that are necessary. I do think a large part of that is meeting people where they're at. So we need to be practical and pragmatic in our efforts. We know that this is the critical year, the critical decade. We must be acting with as much energy and as much conviction and, always based on rigorous science as well. And so I do think it's important that we if we're researchers, we do our research differently. We engage with policymakers and practitioners, for example, right at the beginning of any research that we do, so that we have a proper, thorough understanding of where the gaps are, so we can co-create and co-design solutions that are actually needed and agreed to by different sectors of our community. Of course, the citizens, our citizens, are crucial to these the development of any solutions that we're working on. So it does also push us towards a different mode of working. No longer can we as researchers or as policymakers, do our work in silos, do our work isolated from the rest of the population. It's just vital that we rapidly change our mode of operating. So I think that that's one clear effort we can make, and it is doable. We've seen this occurring over the last 12 months with a lot of work happening in the Indo-Pacific, a lot of collaborations occurring, and that co-design approach really being taken up. I think that we can't downplay the importance of understanding the economic benefits of urgent action and the cost savings, as I mentioned earlier. We know that decision makers are really incentivised by knowing that there is a business case behind a particular solution and that there are clear benefits and cost savings from our activities. So the health community hasn't been particularly good at providing the economic basis for acting on climate due to health impacts, but we're getting better, and I think that's a particular area that I'd love to see more focus on, and a greater capacity development. I could go on with many other examples, but that might do for now.
Thanks, Catherine. It sounds like there are both gaps but enormous opportunities as well in this sector. I think we're coming to the end of the session, so what I might ask each speaker to do is just to think about one key message or takeaway that you'd like to leave our audience with on this question of health as a driver for climate policies. So I might start with you, Dr. Jamila, and then go to Catherine.
Yeah, I think my key message is without health, nothing really moves. And if we are going to address health as a key driver of policy, let's also address the underlying drivers. We can't treat the disease without treating the underlying causes, and this is basic medicine. Stop treating the symptoms, but go to the etiology of where the disease is, and ultimately it is fossil fuels. I just want to say to Catherine, I 100% agree with her. We need to learn from the PR advertising companies, right? How they've been able to sway public opinion on how good fossil fuels are. I think we need to learn from them how to sway public opinion to understand how damaging, climate and our behaviors are on our health.
Thanks very much, Dr. Jamila. And Catherine, your final thoughts?
My final thought is that we all have a role to play, whether or not we are practitioners or policymakers or researchers. Even if we don't work in the health sector, ultimately the impacts of climate change are affecting and will continue to affect all of us and our health and our well-being. We all have a role to play, whether that's becoming more involved in one of our local NGOs, whether that's writing a letter to our Member of Parliament, whether it's joining Extinction Rebellion, whatever works for you. It's really vital that we all take action in the way that we feel comfortable and we feel that we will have the most impact.
Thanks, Catherine. I think that's an important message to end on, that everybody can take action in this space. Health is something that we all need and can contribute to, and I think it's a really powerful lens for addressing climate action. So thank you very much to our two panellists, Dr. Jamila and Catherine Bowen online, for their excellent overview through their comments of why this linkage is so important and some of the big picture kind of trends we're seeing at the global and regional levels. So the next part of the session that we're going to transition to, you're going to hear more about the how of how these policies can be integrated around climate and health and the importance of localising strategies and tools. But if I could ask you to join with me in thanking Catherine and Dr. Jamila for their insightful comments.
Thank you so much to Jacqueline, Dr. Jamila, and also Catherine joining us online for such an insightful discussion and for really setting the scene about why it's crucial to be considering health in the context of climate policies and also all of the different factors that come into play and factors that we need to be leveraging in order to drive this work forward. A few things that we can highlight from that conversation about what it means to center health in the climate discourse. It's about acknowledging that inherent connection between health, climate, and justice, as Catherine highlighted. It's about breaking down silos, thinking long-term, and radically transforming the way that we operate, as mentioned by Dr. Jamila. And I like that we ended on that note, that it is something, health is something that we all need, but also something that we all can contribute to. And now we will move on to the panel discussion, the next session, which will talk in more in-depth about how we can operationalize these interlinkages between climate and health. So I kindly invite on stage our moderator for this session, Jom Narkpitax, Director of Environment and Climate Change from FHI 360, the Asia Pacific Regional Office.
Thank you so much, Belai, for the great introduction. Ladies and gentlemen, welcome to the panel discussion on localizing strategies and tools for climate action. As the Asia-Pacific region undergoes significant changes in demographic, economy, and environment, a variety of climate challenges emerge in its diverse landscape. Coastal areas are dealing with rising sea levels and extreme weather events, putting vulnerable populations and crucial healthcare infrastructure at risk. Some areas are grappling with prolonged droughts and water scarcity, impacting agriculture, food security, and community health. Meanwhile, densely populated urban centers face increased risks of heat waves and air pollution, heightening respiratory and cardiovascular health concerns. The diversity in climate challenges emphasize the need for tailored approaches to climate-resilient healthcare systems throughout this region. And this urgency of change, of climate change, and its profound impact on health forms the essence of our deliberations today. The goal of this panel is to build on the engaging discussions from the preceding fireside chat. We're still focusing on the crucial role of health as a driving force for collective climate action. However, as Belai mentioned, we will transition into the practical approaches and tools and systems for integrating health considerations into policy frameworks. Our esteemed panelists will share their perspective and experiences in developing and utilizing various tools and approaches to guide climate action. So without further ado, please allow me to introduce our esteemed panelists who will bring a wealth of expertise and experience to today's discussion. Joining us in person, first of all, Dr. Kristen Steele, Associate Principal, Climate and Sustainability Services, Singapore Leader, Arab. Please join us on stage. Dr. Seneca Basyanyak, Director, Climate Resilience, Asian Disaster Preparedness Center, or ADPC. Please join us on stage, sir. Jit Sohal, Regional Climate Manager, Healthcare Without Harm, Southeast Asia. And joining us virtually, Sally Edwards, Coordinator, Health and the Environment, Division of Health, Environments and Populations, World Health Organization, Regional Office for the Western Pacific. Thank you for joining us, Sally. And finally, Dr. Connie Gann, Lecturer in Planetary Health, Griffith University, Australia. Welcome. Allow me to move to the center stage as well. All right. First of all, I'd like to say welcome to our esteemed panelists. Thank you so much for joining us today. Allow me to start with Sally, who has joined us and will help us set the scene for this discussion. Sally, could you please share with us an overview of the key policies and frameworks that WHO has spearheaded in integrating health considerations into climate policy, especially the ones that have been localized and contextualized to suit different contexts and issues? Sally, the floor is yours.
Thank you very much, and good afternoon, everybody. First of all, let me apologise for not being there in person, but I hope that everybody can hear me okay. So WHO has been working on climate change and health for over 30 years now, producing frameworks and guidance, supporting elevating health in the climate change discussions, capacity building, Ministry of Health staff, integrating actions between different ministries and using our convening power to bring different actors to the table. And then, of course, implementation at country level of big projects through donor funding as well as our own. Now, in specifics, what does this mean? Well, we've supported many countries developing the health section, in some cases, or chapter or special document of their national adaptation plans. This involves doing extensive vulnerability and adaptation assessments for health and climate change, and really linking into the whole national policy of doing the adaptation planning. We've also been trying to encourage the health part of the national or the NDCs, as have been previously referred to. Over the last few years, we've been promoting and implementing climate resilient, environmentally sustainable healthcare facility initiative, and last week we launched a new operational framework for building low carbon into that framework. So we now have a framework for resilient healthcare facility, resilient and low carbon healthcare facilities, excuse me. Now, all of this is really put into the framework around the Alliance for Transformative Action on Climate and Health, in which we partner with Healthcare Without Harm, as well as the UK Foreign and Commonwealth Development Office. Now, this is following on from the COP26 health commitments and encouraging countries as they become part to really work on their health national adaptation plans, the vulnerability and adaptation assessment, so all of the grounding frameworks around adaptation, but also looking at their own healthcare sector and trying to build in low carbon into their healthcare sector, all the time recognizing that in some cases we need to actually increase the amount of carbon in order that healthcare sector is producing in order for them to provide quality healthcare, because at the end of the day, what we do not wish to compromise is the quality of care that the populations and communities of our regions receive. So it's a balancing act between quality, but all the while with a look to sustainability and low carbon. So in all of the regions, but Asia Pacific, no different. We're really working country by country to really try and support the ministries of health, as well as environment, as well as our national meteorology and hydrology services in integrating and forming these plans. Thank you.
Thank you so much, Sally. We have now started to delve into the key framework and practical approaches and tools. Let us hear more about other approaches that are available out there. Allow me to move to Dr. Steele. With your expertise and experience in systems analysis and environmental impact assessment modeling, could you share with us examples of initiatives, tools, and strategies that have integrated health considerations and have led to enhanced climate resilience in the region? Please.
Thank you very much. So in coming to this meeting, I was putting some words down to try and bring a response to that, so I'll just talk through those. Starting, I guess, with the term resilience, a term that's widely used and in many different settings. When we talk about it through climate and climate action, we often think about it as a characteristic associated with physical climate risks. We want resilient systems in that sense. I think it equally applies, or certainly applies very strongly to transition and decarbonisation as well, because our organisations, our countries, our activities will not be resilient. They'll be stranded perhaps in the future if we don't, if we're not resilient to such changes. So I think it's an issue that cuts across both the sides of the climate coin, as it were. And as we heard from the fireside chat a moment ago, health is at the heart of this, and it's at the heart of both those sides of that climate coin. If we're not resilient to climate shocks and in terms of humans, then there's going to be loss of life or chronic effects, as we heard. But equally, if we're running models on decarbonisation or environmental impacts, we're also using human health indicators there, be it on toxicity or things like summer smog and PM10s and so on. So again, human health comes into both sides of the sort of agenda around the initiatives, the policies and the tools that we might be using for better decision making in that sense. And I think we need this at all sorts of scales, right? We need tools and we need data and we need methods here at global level, at national, regional, organizational, right the way down to facility and even product. So I think that you can imagine all sorts of scales, and some of those are really high level, they're global, I said, or some of them are quite local and specific. So in that sense, the local piece is important, but it's not always going to be there, and I don't think it's always needed there. But a good example, perhaps, to give a perspective of where or how local is important is a tool or a framework that we've been involved in developing and applying over many years now at Arup, which is called a City Resilience Index. And this is about trying to measure resilience in a more general sense beyond climate of a city. And this framework's been really quite successful in its application to cities, but also in the diversity to which it's gone on and been developed into energy or water or other economic sectors. But it has within it a component that looks at health, right? If you think about it as an onion, it's got four basic components, and one of those quadrants of it is about human health. So on a city level, if we're thinking about resilience, we've got to think about humans at least as a key part of that. And within that, you have a whole bundle of different goals that you seek to try and achieve. And there's something like 4 of these, I think, that focus on human health. And underneath this, you have a basket of indicators that you use to test and explore these issues of resilience, of which some of them are human health related aspects. But the critical thing of this, and bearing in mind this is a tool that has been used all across the world in hundreds of city contexts, is that underpinning it is a piece of process, really, that bespokes it and applies it to a localized setting. And that's about bringing in stakeholders, workflow processes, and data to inform that index and inform that assessment that's done. So I think in that sense, bringing the localized component is very, very important. But coming back a little bit to the points that I was talking about earlier in terms of some principles around how we develop tools and bring them forward, I think there are some benefits to working in standardized approaches, right? I think with something like that index that I describe, it is a common framework. Now, with commonality like that comes the ability to be consistent, which means we can compare and we can share and we can learn. There's network effects from those sorts of things. But you need that localized piece that comes in underneath, because it gives appropriate data, it brings people, knowledge, and localized setting and information to the decision-making process. Another theme that I wanted to bring here was the aspect of digital. And this is a wave that the world is surfing right now and will continue to do for many, many years ahead. And I think data-driven decision-making is a real foundation of which we can drive climate action in both resilience and decarbonisation agendas. And in that sense, tools and the ability to ingest data, information that is machine readable, interoperability between our tools and the data that they're using is really, really important, both at the local level but also to share at scales. So this is on, let's say, on a simple level about carbon factors that you can use to understand impacts of local settings. It's about downscaling data from global or regional climate hazard models to settings that we're looking at in a discrete facility or operations. So I think digital and its enabling capacity, its enabling ability is really, really important, and a big part of that is interoperability and data that can be used at local levels. But I think ultimately a tool or something like this is just one part of the sort of the ecosystem of things that we need for better decision making around climate and health. You need the data and the ability to share it and harness it in the way I describe. You need common methodologies that can be embedded in tools or processes. You need guidance, information that can be shared and presented. You need training programs and learning programs. And you need partners and the ability to cooperate and work together. So I think tools is just one part of that equation, of that ecosystem. But I think ultimately and in conclusion, local but also global level is important.
Thank you so much, Dr. Steele. It's genuinely uplifting to hear about this unique approach that you have shared with us in integrating health consideration into various international or standardized tools that you mentioned, which has the potential to spark greater awareness and practices for sustainability and climate resilience across different sectors. And also, you also highlighted a very important point about digital and making sure that it's contextualized for different contexts. And again, information exchange. These are all tools are only parts of the bigger systems, as you mentioned. So thank you so much for making a great point on that. Moving on to Dr. Seneca, please. Dr. Seneca, drawing upon your extensive experience at ADPC, especially in supporting urban climate risk management and conducting risk and vulnerability assessment, could you kindly share some insights into the initiative that you have led or been involved in to enhance climate preparedness for the health sector? Thank you.
Thank you, John. Let me come up with some statistics to set the scene. As we all know that now we are in kind of 1.1 to 1.2 centigrade warming world. It was emphasized in the keynote speech as well. It is very well documented. And 2023 is going to be the warmest year on record as per the statistics. From January to October, 10 months average. It was 2016, but it might be the case in months to come. And in addition to that, summer 2023 summer is already the warmest summer on record. And we have seen several the hazards and disasters as well, led to disasters in most of the countries, like from different regions. And with related to the health issues, of course, the heat waves we have experienced in this region as well this time. I'm not saying those are heat waves, but it's a kind of very much warm conditions we have experienced. And now we are also kind of experiencing El Nino. It's already there and yet to come. So it continues till next year, probably June or July. So this tells a story for us to think very seriously about health risk management in emergencies. So we may be facing more and more extremes to the future, the way that we have seen. Maybe the strength and intensity and frequency, I would say, is going to be more and more. It might be the case. So we need to prepare ourselves. I think we have done a lot in terms of educating people, building capacity through various means of trainings. For example, HOPE programs ADPC has been doing, that is hospital preparedness for emergencies, or even MHPSS and NIE, so many things. So, but at the same time, as our colleague already Christine mentioned, that there are so much of data that probably we need to understand, put them together to develop sort of tools and to understand risks. Understanding risks, it was highlighted through this Sendai framework for disaster risk reductions is one of the pillars. So that is important. Understanding risk is the basis for us to build everything. So ADPC, Asian Disaster Preparedness Center, we are going from Bangkok, Thailand. So we have been using the risk assessment tool where we have a couple of components. Probably the components probably you are aware of. In order to assess risks, you need to have three areas. So the hazard is important, which is climate signal because of the climate change and variability. It comes hazard maybe as we were discussing about floods, storm surge, so on and so forth. The other one is exposure. So exposure is maybe in this discussion, today's discussion, the healthcare facilities, for example, when it comes to physical exposure. When it comes to social exposure, it may be maybe differently abled people or even elderly people and young people or kids, so on and so forth. The other one is, of course, vulnerability. So these are the three components that we put together to understand risks. So when doing this assessment, you need so much of data, which Christian also highlighted. And so data is not shared widely within the country, or even we don't need to talk about the coast region, so it is very difficult to get it into that. And then once it is done, so that we can get an idea about the risk to floods, risk to the other hazards, and then where these, health care system, the facilities are located, which are when in years to come, whether those facilities are in safe or not, maybe we need to make some sort of adjustments. It's not only the hospitals and healthcare facilities, the accessibility to those locations, maybe the roads. If the roads are flooded, so we may not be able to get into that. So this has been using, as I was mentioning, ADPC many years now, and we had a project. Actually, we are still having a project in Vietnam to implement 2 cities. It's basically to improve urban resilience to climate extremes. There, we did very detailed risk assessment, where we identified sort of critical infrastructure, including health care facilities, and then we make some recommendations based on the risk assessment that we did for the future. The typical risk assessment, when it comes to hazard, usually use historical events, meaning that last 30 years, 40 years, what were the events that we faced? But it may not be the case now. So we are now integrating climate inclusive risk assessment, meaning that we are looking ahead, we are getting the hazard information, looking at future scenarios, which of course, again, he was highlighting the downscale information. So this is one of the tools that we have been using. I think this is really important for us to think through. We need to use science-based information in order to understand risks. Thank you.
Thanks you so much, Dr. Seneka. You have shared with us already some very interesting insights from your experience with ADPC, including the risk assessments tools and the important point about using data and its accessibility. So thank you again. Now I'm turning to 2 of my other panelists here, Connie online and Jed Sohal, who are here with us. Connie and Jed have extensive experience in conducting green viability and climate vulnerability assessments in healthcare facilities across Asia-Pacific region. And from the experience that at least I have with FHI 360 in collaboration with Healthcare Without Harm, in order to conduct these assessments and ensure that these assessment tools are effective, They need to be contextualized to fit different challenges and priorities of different areas, as well as for different types of healthcare facilities. So, since you both have led and been engaged in these assessments, I would like to ask you, in your view, why these assessments are instrumental in guiding climate action. And also, could you also please share with us some insights into how these assessments can be effectively conducted in different contexts and integrated into policies and practice? If I could start with Connie first, please. Thank you.
Thank you. I hope you hear me okay. So
Yes.
Joining from Canberra, Australia, hello everyone. I extend my appreciations to the traditional custodian of the lands, as well as all the beautiful lands that we are meeting today. So it's an honor to join voices with all the co-panelists today advocating on this important topic. Thank you, John, for this very great question. So I guess in my view, the breakdown of accelerations, climate actions, or guiding climate actions will be, we want to accelerate the speed to decision making, the speed to taking actions. So that's the two very important pathway or journey. But of course, to ensure those assessments are not only usable, but also useful for the user that then after they've been used. So how to ensure the assessment are usable and useful. So I guess that typically when I connect or collaborate and partner with the ground level clinicians or hospital managers or even policymakers, we ask the question like, useful for who and useful for what, right? So for me, I think I recommend two important points. First, we want those assessments to help us solve the right problem. Second, we want those assessments to help us align with the goals, so that we can have win-win-win or many wins approach. So it's not just solving one problem at one time, but also systemically can we be addressing the root cause. Basically, we don't want to come out from one problem to another problem. So I guess first example, I guess to effectively conduct this assessment in different contexts, I think it's very important. We want to engage the wide range of stakeholders, like Kristen was saying. And of course, all different communities, policymakers, researchers, and businesses. So in short, who cares about this issue? Who will be able to drive the change? And of course, the important, who is paying all the costs? And this will ensure if the assessment will be adopted and all the perspective and knowledge are incorporated. So this will effectively, of course, before knowing the result of assessment, we know that those change will be just matter of time that will be realized in the reality. So of course, the right assessment, I should emphasize the right assessment. Not all assessment is right for or fit for the purpose of the context. Should actually provide us knowledge and information. And we want those knowledge are very powerful to drive change. It's not just, okay, the information is there, good to know, and case closed and goodbye. We want those the information that help us identify what is important now and what can we do now. I guess I want to point out one of the examples that we have in Nepal. So we implement the WHO guide and look at 3 ecological regions. That we know that the Terai region, which is facing a lot of floods, the hilly regions facing water scarcity, and the Himalaya, we are seeing emerging of climate-sensitive infectious diseases. So, for example, in the hilly regions, hospitals there are seeing a lot of water-related diseases. But instead of just waiting for patients to come to hospital, how can hospitals switch, providing clean and affordable water for community? So they built water ATM. So not the ATM that you can go for withdrawing money, but the hospital can provide accessible, low cost, and also clean water for the community. At the same time, also reducing the water-related diseases in the community, and then the hospital is also save some costs in operating, buying, plastic bottled waters. Second examples, how do we align all these goals? So ultimately, we want to save the world. So reducing emissions and achieve resiliency. But to be honest, okay, some of the operating or ground level practitioners, we want to save costs. We want to have more time spent to friends and family. We want a safer workplace. So what do we want to achieve? I think what are the stakeholders intend and to do? What kind of changes would we like to see? What kind of success look like for you? So I guess during my PhD, I studied the health promoting hospitals in the global level, specifically in Taiwan. So 15 years ago, some hospital volunteers started like promoting the global green and healthy hospital goals, leading to a significant cost saving. So without a doubt, it's very obvious. You reduce energy, you save costs. And this stimulates a nationwide program that encourages hospitals to start to report energy, water, and waste. And also, government provide training program to include or incorporate some of the assessments to help drive the change. So this also leads to standardization across Taiwan, initially driven by cost efficiency, but this initiative started to also align with policy goals, catering with very specific local needs. So avoiding just really one-size-fits-all approach. So useful for who, useful for what? In this case in Taiwan, assessments are very useful to build strong case database. That is not only for several hospitals, but also needed for the whole system level. Different level of hospitals, government can develop or redevelop policy that support diverse levels of healthcare facilities at the national level. So this create a push and pull forces. So the peer pressure as well as the international community identity building. So in Taiwan now, more than 140 hospitals collectively develop a movement of change, a transformative actions of change. So of course I can go for many days to talk about different stories from all those projects in Indonesia, Vietnam, Australia, or across Asia Pacific. But in summary, the two approaches. Assessments are very instrumental, but the right assessment can guide climate actions that provide evidence-based understanding of the current situation, trend, and potential future scenario. So to make it more attractive for the user, 2 points. I guess first, help us solve the right problem, and also help us align the goals that we can achieve. I will stop here. Thank you.
Thank you so much, Connie, for highlighting very important points about making sure that these tools or approaches, which are the assessments, solve the right problems as well as fulfill the expected goals. Turning to Jit as well, please, for the same question.
Thank you, Job. I think Connie mentioned, and the rest of the panelists mentioned a lot of really, really great points already. So I'm going to add just a couple of them. I think to add to what Connie said, vulnerability assessments, these evidences help us prioritize what adaptation strategies that healthcare facilities or healthcare systems can do and can implement to build climate resilience. And I think, with vulnerability assessments at the national level, it helps, and it's a very crucial component of the Health National Adaptation Plan, which Sally mentioned earlier. And what gets into the HNAP gets funded. And it's similar at the facility level. What's in your climate action plan as a healthcare facility can also, or mostly those that are going to be budgeted. So we want to make sure that these evidences from these assessments lead to specific interventions that will get budgeted, which is important. So in terms of contextualization of these assessment tools, I think it's really important because challenges that are faced by healthcare facilities and healthcare systems are different within countries, across regions. For example, the challenges faced by a rural clinic will be different than that of an urban hospital. A tertiary hospital, even for Singapore, will be different than a tertiary hospital in Timor-Leste, right? So we need to make sure that the tools that we use to assess vulnerabilities in these healthcare facilities are looking at and reflecting those distinctions. And these tailoring process ensures that it's fit for purpose and capable of capturing the nuanced realities of each unique setting. And WHO guidance, the guidance that Connie, that Sally referenced earlier on guidance for climate resilience and environmentally sustainable healthcare facilities, it has the checklist to assess vulnerabilities. They underscore the importance of contextual adaptation. WHO mentioned that in the tool. And if you have seen the tool, it's about 500 questions in total, but for different hazards, right? So when you go into a healthcare facility, you can't answer all 500 questions, and not all of the hazard checklists will be relevant for you. So just to share some examples that we've done on the work that we've done in Timor-Leste and with FHI in Thailand. So the checklist, we had to adapt it and tailor it to the context of Timor-Leste and Thailand. So even within the Timor-Leste and Thailand healthcare system, there are different levels. There are tertiary, secondary, and primary, so we had to also come up with different sets of checklists. You cannot have the same checklist for a tertiary hospital and a primary care facility in the mountains and tertiary hospital in the city, right? So having that tailored and localized tool, that's also not 500 questions because healthcare facility managers don't have hours to just answer questions. And the tool actually has a lot of similar questions that you can integrate, but making sure that as you do this adaptation process of the tool, you don't lose the nuance of each of the questions or each of the indicators in the checklist that you need to ask that are very specific to a hazard. So what we did is combine the indicators in the tool into one, but have different versions of it for tertiary, for secondary, and primary. Still, we had a lot of lessons in that practice. We don't say that it's the perfect way of adapting a global tool to a local context, but we see a lot of opportunities for us to learn from that experience. Definitely one is that you need to co-create the adapted and tailored tool with people on the ground. I'm not from Timor-Leste, our team is not from Thailand, so we don't have that local knowledge. So you have to have people on the ground who know better than you to help you co-create the tool for them, because it's their tool. So a participatory, multidisciplinary approach, collaborative, co-creation approach, which were all mentioned since earlier, is necessary. Its local knowledge is paramount, so to ensure accuracy and relevance. So our tool, we translated it, the adapted tool from WHO, we translated it to the local language, but then you go and ask the question and show the question or the checklist to the healthcare facility on the ground, and they don't get the question because the translation, although it's correctly translated, it's not reflecting or it's not relevant or understood by them because it's not, that's not how they phrase the question. Or, for example, have you conducted climate change and health or emergency planning? This is just an example. They won't, some of them won't understand what is climate resilience planning. They understand disaster preparedness planning. So having people, having local knowledge of what is relevant in that specific context is important. One thing that we also realize is we cannot rely on just asking them yes or no, high, medium, low. You need to have an incorporation of both qualitative and quantitative elements into your assessment. So that involves, for us, going and having interviews, focus group discussions, beyond doing the checklist, and also doing site visits and going around the hospital and seeing all the facilities, all the components in person. And I think the other one is also one thing that we see both in Thailand and in Timor-Leste is we need to look further into how we better assess primary healthcare. Because we cannot focus just on the facility, like what our other panelists mentioned. We also need to look into how the community fits into that, and how you can have a very resilient infrastructure of a facility there, but if communities cannot access your service during a disaster because of road blockages, then what's the point of having a resilient healthcare facility? And I think just last 2 points, Christian mentioned this as well, is that peer-to-peer learning. I think within a country and between countries, there is opportunity to learn from experiences on how to best adapt a tool or to conduct national adaptation plans or climate action plans for healthcare facilities. What worked for them, what were the challenges, and how we can replicate those initiatives in our own facility or in our own country. And I think the last point would be that most of these adaptation actions that we see, whether it's in Thailand or Timor-Leste, we see that most of it need to involve other sectors. So how do we make sure that as we develop conduct vulnerability and adaptation assessments and prepare adaptation plans, whether at the facility or national level, we involve other sectors, water, energy, because most of the health facilities rely also on access to clean water supply and access to electricity that are really essential for building climate resilient healthcare. So.
Thank you so much, Jit, for highlighting very critical and perhaps thought-provoking points as well about multi-sectoral collaboration, also highlighting the adaptability of the tools, but you also need to work with the communities, the local people, to really understand the context as well. Great. I think we have a little bit of time to take 1 or 2 questions. If any of the participants is interested in posing any questions to the panelists or share your thoughts, your experience, your viewpoints, please feel free to go up to that microphone and share any question or insights you might have. Thank you. Do we have any online question by any chance? Okay. All right. If not, I think I have the final, a little bit of a fun exercise for all of our panelists, actually. So before we end our session, I'd like to ask all the panelists in 30 seconds to 1 minute, actually, building on your wealth of expertise and experience, I'd like to invite you to either share, you have the options, to share an advice or a call to action on how we could effectively harness the intersection between climate and health to drive collective and sustainable climate action in Asia Pacific. Let's reverse the order. If we could start with Jit, please.
Thank you, Job. So I will build on what I just shared, that climate resilience manifests itself in diverse settings and contexts. So we can't have a one-size-fits-all approach. And that just doesn't apply to facilities, that applies to national level. And our pursuit of resilience needs to be adaptable, tailored strategies that are deeply rooted and that resonate with the specific needs of of these communities, of these facilities, of each of the country in this Asia Pacific. And I believe in the power of collaboration. And I think a lot, the world can actually learn a lot from the Asia Pacific region and the Asia Pacific countries. Thank you so much.
Thank you so much. Great point. Fleur, did I just, there's one person, sorry, if I could put on the hold to this exercise first, I think there's one question from virtual. Not anymore. Okay, all right. Connie, please.
I guess climate resilience is not an option, it's really necessity. But I guess the transition or the journey must not come at the cost of social justice and inclusions. I guess in the recent Tuvalu agreement in Australia right now, we sometimes feel is it really solving the root cause? So whether is it here in Australia or other parts of the Asia Pacific, I guess or climate resilience transitions, we really need to also include the indigenous people, person with disability, or other marginalized and adverse groups. I hope their voices can also be front and centered, including development or implementing all the assessments. Especially those already being very behind in our community, we can't really ask them to bear more costs of these transitions, and yet many of them already. So the dilution of these transitions of climate resilience, sometimes you get trapped for the low-hanging fruits or really cherry picking. So some organizations or institutions really just choose to bind certain understanding or certain tools. But I guess the lack of results, the result will be like lacking of coherence in how we approach it. The transitions, the just transitions, or really the radical transformations in organizations or the whole health system. So the risk is really there for greenwashing. So I just wanted to point out that integrating all this assessment is important into policy and practices. Even aligning all the goals and make sure we are not creating more work for our healthcare workers or staff is really supporting their amazing work. And hopefully all this assessment is just clarify what is the goal and how we identify feasible actions that we can move all in the same directions, and these forces and driving forces can sustain. Thank you.
Thank you so much, Connie. Very powerful points you made right there. All right, after Dr. Seneca, please.
Yeah, 30 seconds, no?
30 seconds to 1 minute. Thank you.
Okay, very short. So call for action for maximizing utilization of the science-based information to understand risks, to improve health risk management in emergencies. That's it.
Perfect. Thank you so much. Dr. Steele, please.
Okay, I think I have two things to say, and I'll probably go down the advice route or the reflection route. So first of all, I think the hypothesis on localization is absolutely there. And to make it personal, what's my carbon footprint? Do I know it? Do you know your carbon footprint? And what's the budget? What's the emission budget that you should be operating in over the course of 12 months, right? And I think that's needed on the emission side of things. And then if we think about it on the resilience side of things, what's local to me? Am I doing a national adaptation plan, or am I running a facility or designing a new project? And are you testing that context to a 3-degree warmed world? And unfortunately, I know in so many settings we're not. Okay, so I think we really need to localize this agenda. And then the second thing I wanted to say was, and I'm not a digital kind of guy, right? I'm quite analog actually, but staying on the digital trend, I do think it's a real enabler for us. So in the work that you are doing, in the programs that you are running, think about how you publish and how you share. Think about how your outputs can be used by others in machine-readable formats, in interoperability environments, and in open data environments, because I think the ability to share and utilize information across us as practitioners is a real enabling tool to enable us to address climate resilience and decarbonisation.
Wonderful points from all panelists. Thank you so much. Is Sally still there? Sorry. Yes. Sally, please. Apologize, I didn't see you.
No problem. So just very briefly, climate change and health inherently is intersectoral, and we need to ensure that we're bringing the different sectors to the table for them to work together, not just to pay lip service to the fact that it's intersectoral, but really try and achieve it, and understand that no one size fits all. So whatever we do, it must be a stepwise approach, and it must be achievable for countries. Countries can't be so, or populations or communities, whichever level we choose to start at, can't be so overwhelmed at the beginning that they just don't know how to move forward. Thanks.
Wonderful. Thank you so much. We're almost there. I think all about the panel is actually alluding to the fact that no one size fits all approaches. Localization, contextualization is key. I'd like to thank all of our distinguished panelists for joining us today, both in person and virtually, for their valuable insights and perspective in this enlightening session. It is evident that we have collectively gained a deeper understanding of the pivotal role health can play in the climate crisis and the critical need to integrate it across all sectors in a context-specific manner. As we move forward, let us remember that collective action is our most potent tool. By uniting all key stakeholders together, we also mentioned about multi-sectoral collaboration, we can inspire a brighter, healthier, and more climate resilient and sustainability future for all in the Asia-Pacific region. Thank you so much, everyone. Please join me in thanking all the panelists. Thank you. And I'm handing the stage back to Belai, please, to conclude our session. Thank you.
Thank you so much to John and to our speakers, Sally, Christian, Dr. Sanaka, Jit, and also Connie, who joined us online for sharing all of your perspectives and experiences in developing practical approaches and tools for integrating health considerations into the policy framework. I think all of your key takeaways have really perfectly summarized today's discussion, but I will try to share maybe two key takeaways from both the fireside chat as well as the panel discussions from today. First is really that need to deepen our understanding of the cross-cutting nature of health and its relevance across the diverse forms of climate interventions, and the importance of fostering a more comprehensive, systems-oriented approach to addressing climate challenges. In the context of climate and health, this could mean integrating multiple levels of the health sector, whether including the wider health systems, the health facilities, and also leveraging on the role of health professionals in advocating for and advancing this discourse of climate and health. And as we think about operationalizing this knowledge and interconnections, it's important that we recognize the complexity and the nuances that each country and region bring into this process of integrating climate and health. And so taking away from what was discussed by our panelists earlier, it is about localizing all of these different tools and frameworks that we will be using. How do we bring people, knowledge, and localized setting and information into the data collection process, which will in turn inform the decision-making process? And how can we ensure that the tools, frameworks, and assessments that we create are co-created, fit for purpose, lead to specific interventions, and reflect the unique context that it is used in, with the ultimate goal of integrating health in all policies and building resilient healthcare systems in the face of climate challenges, protecting both our people and our planet. Thank you once again to all of our moderators, speakers, and also participants who have joined our session, Resilient Health Systems, Localizing Climate Policies and Tools for Accelerated Actions. And we look forward to broadening, advancing, and operationalizing the climate and health discourse with all of you. Thank you and have a good rest of your day.
Switch it off. Okay. Boleh off tak? Terang sangat. So it's black. Off terus. Tutup terus. Thank you so much. Thank you so much.
So much for everything that you shared earlier. It was such an honor, and I think we do work with ARUP previously as well, Healthcare Without Harm. Oh, ADPC. Oh, sorry. We did work with ADPC.